Years ago, when AIDS was a new phenomenon in the United States, it's 1982 as I recall, the AIDS patients that would come into hospice, which is where I was working at the time, would have all kinds of interesting and opportunistic infections, including pneumocystis pneumoniae, which is a type of pneumonia that is almost exclusively seen in people with a depressed immune system, which of course AIDS patients had. But AIDS was very new to the medical community in the U.S. in '82. Really, it only hit in the San Francisco and New York area in 1979. So in the middle of the country, Amarillo, Texas is where I was. It was a pretty new phenomenon, and we were beginning to take care of dying AIDS patients. Well, pneumocystis pneumoniae has a medication that will actually help fix it. It takes it away completely, and called pentamidine. And pentamidine was an orphan drug for years and years and years, but it was developed in the 1960s, and it was used in patients who got pneumocystis secondary to leukemia and other immune deficiency processes. And in 1982 May, a bottle of pentamidine, which was used for 2 IVs, and it takes 3 a day to treat it for 10 days, cost $26.79. By June, 1 month later, when I called to order some pentamidines from the pharmacy for an AIDS patient, the price had gone to $526.50 per bottle. So by the time you finish treating that AIDS patients for 10 days to help them breathe better while they were approaching their death, you could spend anywhere from $8,000 to $10,000 for a medication that just a month before would have cost about $200. This upset me greatly because I wanted to take good care of our patients, and most of our AIDS patients didn't have that kind of money. And so I actually called the pharmacy company at the time, being a brash young PA, and said, what in the hell were they doing? And their explanation of the price hike, as that's what they called it, was that pentamidine was a drug used only in these specific disease processes of leukemia and other types of immune deficiency, and that it had never been tested in AIDS patients. So they had to go back to the drawing board to get a FDA approved specification for treating AIDS patients, and so they had to pay for that. So that's why the price had gone up so substantially. This really frustrated me as a provider and also as a taxpayer, because as far as I was concerned, it was pure out-and-out gouging, because we already knew that the pentamidine would work in a immune deficient patient. We'd known that for 30 years. So what was new now? Well, what was new now is they can make a lot of money, as far as I was concerned. Now, this story is to illustrate for you that in week 7 and 8, we're going to be talking about who pays for all the stuff that your virtual patient population is getting in your virtual skilled nursing facility. How is this all paid for, and who are the players, and how do we set things up? And you're going to be reading about closed systems and stakeholders and SWOT, SWOT, and the various people who finance or don't finance the things that you'll have in a virtual skilled nursing facility. One of the big players, of course, is Medicaid, who pays for the vast majority of long-term care in skilled nursing facilities, which is actually a mix of state Medicaid and federal Medicaid dollars paying for the care of your patients or residents. Medicare also has some pure, straightforward things that it will pay for. There is starting to be some insurance policies available for long-term care, particularly skilled nursing care, but also care that is not involving long necessarily skilled nursing care, but home care and care that's in between community-based activities. And there are some charitable nonprofit organizations, some of the Catholic and Christian organizations in particular have some long-term care nursing type facilities out there in the world. So you're going to be looking at all those people who pay for the process. If you look at this, you will find that currently almost no patient pays for the care that they're receiving day to day in a long-term care skilled nursing facility. Somebody else is footing the bill, and it's usually Medicaid and Medicare. And as you can imagine, as the numbers of people who use these facilities will increase with the aging baby boomers hitting the doors of your skilled nursing facility soon, that you're going to be more interested on who's paying the bill, because you're paying the staff that you just hired a good wage with lots of opportunities to improve, so that they will not just provide decent care, but compassionate, wonderful care to your clients, your residents, your patients. And that takes time and money. So you're going to be looking at budgets and labor and managing your revenue and whatnot. And I'm not trying to turn you into budgeteers or make you into an accountant, so we're not going to get too carried away. The idea is to understand the concepts of what it takes to run a business, because while you are taking care of the patient, you also have to run a business. And this is connected, because taking good quality care of a person who has Alzheimer's, or who's been shot in the neck and is 16 years old laying in a bed, or needs hospice care for a period of time, it's all about taking good care of them. And if you don't get paid, you can't have people in your facility that are going to deliver that care. And delivering that care is more than the skilled nurse that we keep talking about. It is the housekeeper who's keeping the floor clean so that there's not as many infection control issues, which then keeps the inspectors happy, because you're not giving your patients pneumonias and other opportunistic infections. It all plays on itself. Every cog, whether it's the janitor, the food service person, the vendor that brings in the food or the medications, or the pharmacist who mix up the IVs, or the nurse who delivers it, or the CNA who wipes the butt of the patient, it all combines to deliver excellent quality, compassionate care to a live, real person who is a mom, a dad, a brother, or a sister. It's important.